What made you, as a practice owner, make the investment to bring diagnostics in the practice and not only bring this concept with you, for you only, but to share this knowledge and expertise and this program both with Scott and Jake? What was that driving force?
Before we even joined, I think 2015, I had a meeting. At the time, we decided it wasn't quite the right time, but I always knew that this is going to help elevate us and help us stand out. And, we see a lot of direct access patients. So that primary care physical therapy concept and being able to offer diagnostic testing for patients that come directly to us is huge because it also helps us with being able to refer out appropriately. Twofold. One was elevating our practice, elevating our patient care. The other aspect is with the decrease in reimbursements and those kind of things, we're looking at, okay, what are other ways to help sustain and continue to grow so we can continue to help more people? Diagnostics was an avenue to help with that. So that was the other aspect. Now, when I first joined Hands-On Diagnostics, what really interested me was the MSK ultrasound, because you could see that. Didn't know a whole lot about the EMG nerve conduction study, but that's a whole different ballgame. And that's been a great addition to our clinic. And we get patients referred directly to us just for that test. What made us want to get Scott and Jake involved? These are key players in our clinic, especially Scott and Jake now as well. I knew they would take it and run with it and do well with it. Even though it was tough, it's been great to help us all be better clinicians.
That's awesome. And I would say that not every private practice owner will make that type of investment to their employees. So that is really, really awesome that you did. Scott, I want to ask you, what did it mean to you for Tony to go on a limb and make that type of investment for you guys and bring you at a level right now, being board certified in electrodiagnostics, at a level that only very, very few physical therapists have attained in the entire country? And when I'm saying very few, I really mean very few. We have right now 25,000, 27,000 orthopedic specialists in the country, physical therapy orthopedic specialists. But when it comes to clinical electrophysiology specialists, we have, I think now, 240, something like that. And half of them are in academia. The practicing ones are less. Actually, last year, out of 21 people who became board certified in electrodiagnosis, 18 were graduates of our program. But what did it mean for you, Scott, for Tony and Kinetics to make that investment for you guys?
I think it's kind of evolved as we've learned more about what it means to be doing diagnostics. You just spoke to how, powerful the HODS program is and the residency training that you guys offer. And I'm so thankful that he did invest in us, me and Jake, to be a part of that. It's very exciting to be considered one of those specialists in our area, to be able to provide those services. But honestly, I think when we started, I didn't really fully grasp what that meant and what all we were getting into. So it's grown a lot over the years, and I'm more and more thankful, every day and every year being able to utilize these skills and help people find answers and get them the help that they need. We can be so much more specific with our treatments now than we could before. And I've joked that I'm still kind of taking my foot out of my mouth because I remember when Tony first brought this up to me, back, I think it was around 2015, I saw the HODS magazine and Diagnostics. Oh, Tony, is that really going to make a difference in how we do things? And you can bet your butt it does. And we're so thankful to be a part of it. And I thank Tony all the time for all the trust and mentorship he's given me over the years. So very, very blessed to be a part of the team.
Jake, for you, what difference has it made in the way you approach a patient? How do you approach a patient now differently that you have the knowledge and expertise that you have?
Over time, it's also improved my exam skills. So I evaluate a patient completely differently now. I'm already kind of thinking along the lines of what test is going to be most beneficial or combination of tests is going to be most beneficial for that patient. I can rely on confirming or denying my conclusion of my physical exam based on the diagnostic test. And it's so neat to, over time, start to kind of get a hypothesis going of maybe what we'll see on ultrasound or what we'll see on EMG based on a physical exam, and then to be able to take that patient the next visit or same day and do that test and see consistent results has been really just such a great learning experience in every way.